This is the last video in our series. In our first video, we shared with you an overview of the new Heart and Vascular Program at the hospital and how it will introduce a more comprehensive cardiovascular program, combining the expertise of the talented physician and clinical team with the capability to provide a full spectrum of cardiovascular medicine, all under one roof, close to home. The second video described the importance of a new service, electrophysiology and electrophysiology studies. In the third video, we discussed how the new program will enhance educational opportunities for the hospital staff. Now we want to share how the program will assist with cardiac echoes and pacemakers. If you haven't seen the previous videos, visit our website at tvrhfoundation.org or call the Foundation office at 352-751-8871.
I was at the Villages Hospital when my cardiologist had started my workup for a nuclear stress test. And that was the first time that I discovered that I actually had a problem with CAD, and I had no clue other than hypertension. And when I was here, I went to the cath lab. They did the nuclear stress, and also she did a physical stress test on the treadmill. And all the people in the cath lab and that were there that day, they're so kind and so good and helpful and calmed me down, because it was an eye-opener, to say the least, and told me that no worries, the next step will be the cath. I found out later. So that's, anytime I've ever been here at the Villages for any reason or purpose, I've always felt at home.
We perform thousands of procedures every year. And within that realm, there's pacemakers, defibrillators, electrophysiology, coronary work. And so we have a very robust specialty and excellent, superb, top-notch selection of medical staff that helps us in taking care of our patients and serving our community.
Well, what I'd like to talk about is transesophageal echocardiography and how we utilize it. First of all, the procedure is basically one in which we bounce sound waves from the esophagus through the heart so that we can see each one of the valves, and we can see the upper chambers of the heart, and we can see the ventricles, or the main pumping chambers of the heart. And there are many uses for this procedure. One of the uses is to look for clots, and clots may be present in the left atrium or the right atrium, or most commonly the left atrial appendage. And those clots can go ahead and cause strokes. And those strokes obviously develop into manifestations of difficulty speaking, or difficulty walking, or difficulty talking. There are other uses for the procedure, and those include infections. Very often patients come in with infections and we don't know what the source is, what the cause is, and we find that the cause of the infections may be one of the heart valves, and we can see the heart valves very clearly with the use of transesophageal echocardiogram. Well, a lot of these procedures are very time dependent. We need to do these in a rapid fashion, and with a busy lab, sometimes we have to wait, and that entails delays for the patient, concerns for the patient, and use at times of external devices to pace the patient until we get the procedure performed.
I cannot thank our community partners enough for the impact of their gift on every life that we save.
In closing, I'd like to thank you on behalf of the Foundation for all the support you have provided since March of 2013, the inception of our foundation. Because of your support, our businesses, which consist of the hospital gift gallery, hospital cafe, and the thrift shop, continue to increase revenue. Our scholarship program has reached over 100 students, and our endowment fund exceeds $400,000. And the room naming program has over 100 sponsors. Because of this, we've been able to provide over $10 million to the hospital. Now we embark on a new campaign to fund the Philips scanner. Please join us in this new adventure. Our goal is to raise $1.4 million. And a special thanks to a very generous donor who has pledged a $75,000 matching gift for any individual, business, organization, or club that makes a financial contribution for the first time to our foundation. Will you consider helping us as we save and change lives? Thank you for your time.